Have you ever just felt completely swamped by health information? I mean, one day it's a superfood, the next it's some detox cleanse, or you see a miracle cure popping up on social media.
Oh, absolutely. It's everywhere.
Yeah, and it's really frustrating trying to cut through all that noise, to figure out what's actually important, what you can do, and what's genuinely based on evidence.
Yeah.
So today, we're doing a deep dive into something kind of behind the scenes, but really vital, knowledge translation, or KT. We're looking at how it helps strengthen health policy and practice.
Precisely. And our goal here really is to unpack this whole journey, how critical research findings actually move from, say, a lab bench or a study
Right.
into real-world health outcomes, and how they end up shaping the health policies that affect all of us. We'll be leaning pretty heavily on a big scoping review by Khatri and colleagues from 2025. It gives us a great roadmap.
Okay, so knowledge translation, KT. It sounds maybe a little academic,
A bit, maybe.
but it seems like it's tackling something fundamental, this knowledge to action gap people talk about. So what does this translation process actually look like in healthcare, and why is closing that gap so critical?
Well, at its heart, KT is this dynamic, ongoing process. It's not just a one-off thing. It's really about making sure important research doesn't just, sit on a shelf.
Gathering dust.
Exactly. It needs to be actively interpreted, sometimes adapted, and then applied to actually make health services and policies better.
Yeah.
That gap you mentioned, it has real consequences,
Right.
like a discovery that could save lives never reaching patients, or a public health strategy that works but just isn't adopted widely. KT is basically the whole system designed to prevent that disconnect.
Got it. And the system, this pipeline, needs people in different roles, right? The review mentions evidence producers, researchers, basically, and evidence users like policymakers or doctors. But there's this third group you mentioned, kind of in the middle, knowledge brokers.
Yes. And the knowledge brokers are fascinating because they play such a pivotal role. They're not just passing messages along. They're often actively translating, adapting.
Making it make sense for different groups.
Precisely. They can be intermediary organizations, professional bodies. Think of the World Health Organization, for example. They produce guidelines, sure, but they also work really hard to bridge the gap between global research and what happens on the ground locally.
Okay, so when we talk about the evidence or the knowledge being translated, I think most of us immediately picture, scientific papers, clinical trial results.
The formal stuff.
Yeah. Right. But this review highlights something else, too, called tacit knowledge.
Yeah.
What's that about, and why is it so important here?
Oh, this is really key. So you have your review-informed findings. That's the classic rigorous evidence from systematic reviews, the gold standard. But tacit knowledge is just as vital.
And
That's the knowledge gained from direct experience, from living it. It includes community values, understanding the local culture. It's the wisdom you get from talking to community members, health workers on the front lines, patient groups.
okay. So real-world context.
Exactly. Without incorporating that tacit knowledge, even the best research might just fall flat because it doesn't actually fit the reality of the community it's supposed to help.
Right. So you've got these different types of knowledge. How does it actually move? How does it get used? What are the sort of mechanisms, the platforms and tools the review talks about?
Good question. So platforms can be things like formal policy advisory committees, or maybe regular meetings where evidence gets discussed and reviewed, structured spaces.
Okay.
And then tools. Well, that could be specific frameworks, like one called the Health Information Impact Index, which kind of scores how well evidence is being used in decisions.
Like a report card for evidence use?
Sort of, yeah. And increasingly, we see digital tools and social media playing a huge role in getting information out there. Think about telemedicine, for instance. That's a tool that's really helped tackle health inequities, especially in rural areas,
Yeah.
just by making expertise more accessible.
Okay, so this is where it gets really interesting for me. With all these pieces, the knowledge, the people, the tools, what actually makes KT work? What helps it succeed? What are the big opportunities?
Yeah, the enablers.
Yeah.
The review points to a few crucial ones. First, you really need supportive health system leadership, leaders who value evidence and actually act on it.
Makes sense. Top-down support.
Definitely. Then collaborative partnerships are huge.
Okay.
Getting everyone involved, researchers, policymakers, practitioners, community members, and not just consulting them, but actually co-producing the knowledge together.
So building it collaboratively from the start.
Exactly. That builds ownership, makes it more relevant. And finally, maybe most importantly, the contextualization of evidence. Making absolutely sure it fits the specific local needs incorporates those local voices in tacit knowledge we talked about.
Because a one-size-fits-all approach just doesn't work in health.
Rarely. Local buy-in is everything.
Okay, that's the ideal scenario. But reality often involves roadblocks. What are the big challenges that get in the way of effective knowledge translation?
Oh, there are definitely hurdles. A major one is inadequate institutionalization, meaning KT isn't always built into the system as standard practice. It might just happen sometimes, sort of ad hoc.
Okay, not systematic.
Right. Then you can have rigid organizational hierarchies, places that are just resistant to change or new evidence sticking to how things have always been done.
Inertia.
Big time. And another critical one is fragmentation. Different groups working in silos, maybe not sharing information or even putting out conflicting messages.
And that fragmentation. That sounds like it could be a real problem, especially with things like social media amplifying messages.
It's a huge problem. It doesn't just slow things down. It can erode public trust. When people get confusing or contradictory information, it opens the door wide for misinformation to spread.
Yeah, I can see that. Okay, so let's pull this all together. We've talked about the process, the players, the knowledge types, the tools, the opportunities, the challenges. What's the big takeaway for you, listening right now? Why does understanding KT actually matter?
Well, I think it matters because this whole complex process, translating research into action, is absolutely fundamental if we want stronger, more effective health systems.
Mhm.
It directly shapes the quality of care you receive, the public health programs in your community.
And the trustworthiness of the health information you encounter.
Exactly. It's about making sure the health system learns and adapts based on the best available knowledge, both formal and experiential.
Right. So considering all of the different kinds of evidence, the role of brokers, the challenges like fragmentation and misinformation, here's something to think about. How can you, as someone who uses the health system, demand and maybe even contribute to making it more evidence-informed right there in your own community?